with us to tell people do not gather. We've seen tremendous adherence. There are clearly still some who are violating, and we will be very harsh about that. So it goes like this. We're going to have police there to not allow people to gather. If someone gathers that we didn't hear about, we'll go break it up, send people home. If people need violations up to $1,000 per person, we will do that. Again, we don't want to do arrests unless someone is absolutely refusing police instructions, then arrest is an option as well. But we have been over this and over this. So all we got to do now is know the locations. Commissioner Shea has been abundantly clear that there will be full enforcement. And anyone who gives me a location, I will make sure the police are there. And if for any reason the police don't follow through, then that precinct commander will be in trouble. It's as simple as that. This is a crisis. This is about saving lives. So this is real serious stuff. So let's be really clear. It's going to be super easy to tell who's doing their job and not doing their job. Just give me the places and the times, and we will do the rest. Jacob, thank you. Really appreciate that. Keep that information coming in, and everyone else. And again, that's a good note as we wrap up here. Look, again, I don't like the notion that we're going to have New Yorkers calling in reports like that. I don't like it. I don't think anyone likes it. No one wants to do it. No one wants to see someone get a $1,000 fine. No one wants to see this kind of enforcement action have to happen, but it does have to happen. And this is what I keep coming back to. If you don't like this crisis and what it's doing to us, you got to actually do something about it. Now, the vast majority of New Yorkers are, and I say thank you. I really do. You've been amazing. The folks who still don't get it are going to have to pay a price. And so, please, help us do what is right and what is just. If you see it, call it in, send the photo in so we can do something about it. Anyone who's ignoring these instructions is putting other people's lives in danger. And, you know, I would say to people across all communities, every part of the city, all families, all cultures, every neighborhood, people love our elders. We respect our elders. They're the ones who are in danger. If we don't follow these rules, you know who's going to suffer? Folks in their 60s, 70s, 80s, 90s. Those are the people we are supposed to love and honor, but if we don't follow these rules, we're putting them in danger. So when you call 311, when you send a photo, you're actually protecting people. You're particularly protecting our elders. You're protecting our healthcare workers. We need to do it. And then it is our job in the city. It is the job of the NYPD. It's the job of all our enforcement agencies to follow through and show people there are real consequences, because that's how we'll save lives. With that, everyone, again, it's a beautiful spring day. Enjoy it a little bit and then get on back.
Britain, including 21,626 tests carried out yesterday. 120,067 people have tested positive. That's an increase of 5,850 cases since yesterday. 18,118 people are currently in hospital with coronavirus in the UK, compared to 18,006 on the 17th of April. And sadly, of those hospitalised with the virus, 16,060 have now died. That's an increase of 596 fatalities since yesterday. We mustn't forget that behind every single statistic, there is a heartbreaking story, and my sincere condolences go out to everyone who has lost someone that they love. These are challenging times for all of us, and each of us has a role to play in fighting this virus. Those who are working in the NHS, those doctors, those nurses, those cleaners, those porters, those ambulance crews, they're all doing an amazing job. They're truly heroic in the part that they're playing in supporting every one of us in this nation. But today, I would also like to say how enormously grateful we are for those who are working in our nurseries, schools, colleges, universities, and children's services. I'm profoundly grateful for the vital role they're providing in our communities. They've been keeping schools and nurseries open, including over the Easter holidays, so that our most vulnerable children and children of critical workers can continue to be supported and they can be cared for. People are anxious to know when we're going to relax restrictions, when schools are likely to be fully back and open again. Of course, I want nothing more than to see schools back, get them back to normal, make sure that children are sat around learning and experiencing the joy of being at school. But I can't give you a date, because before we do, we need to meet 5 tests. First, we must protect the NHS's ability to cope and be sure that it can continue to provide critical care and specialist treatment right across the whole of the United Kingdom. Second, we need to see daily death rates from coronavirus coming down. Third, we need to have reliable data that shows the rate of infection is decreasing to manageable levels. Fourth, we need to be confident that testing capacity and PPE is being managed with supply able to meet not just today's demand, but future demand. And fifth, and perhaps most crucially, we need to be confident that any changes we do make will not risk a second peak of infections. When we can be sure that we have met these 5 essential points, we can think about getting children into schools again, learning, mastering new ideas, and being with their friends once more. We will work with the sector to consider how best to reopen schools, nurseries, and colleges when the time is right. Our first priority has always been protecting the well-being of children and young people, but particularly those vulnerable young people with special educational needs or a social worker. Schools are open for them, and we're working to make sure those who should attend do so. Places are available for children of critical workers too, with up to 130,000 children in school every single day. Schools are helping to keep the country moving. And we're asking our local authorities and schools to ensure every vulnerable child knows that their school is there to support them, that systems are in place to keep in touch with those children who are unable to attend because of health reasons. I know that families of seriously ill and disabled children are particularly worried at this time. And I'm grateful to all staff who are working so hard to support their education, health and care, particularly those in special schools and residential care homes. Young people who have left care or just about to, whether that's from a foster family or residential care, are really vulnerable right now. So I'm asking local authorities to ensure that no one has to leave care during this difficult time. The £1.6 billion of additional funding announced yesterday will help local authorities give care leavers and other vulnerable groups the support that they need at this difficult time. To further protect children from harm, we're continuing to support Childline and working with the NSPCC to expand and promote the Adult Helpline by providing them with an extra £1.6 million. This means children have someone to call, and more adults will be able to raise concerns and seek advice about the safety and well-being of any child that they're worried about. Like the rest of the population, all our teachers have had to adapt very quickly to new ways of working. They've had to move resources online, work remotely, change the way they support their students as well as one another. I'm immensely grateful to them and to everyone who has offered their support, including those who've made resources freely available for schools, parents and pupils to use. We have already published an initial list of high-quality online educational resources, including how to support physical and mental well-being and materials for teaching children with special educational needs and disabilities. In yet another example of how we are at our best when we work together, some of our leading state schools have collaborated to open the Oak National Academy, which will be launched online tomorrow. This is a totally new initiative led by 40 brilliant teachers who have assembled video lessons and resources for any teacher in the country to make use of if they wish to do so. 180 video lessons will be provided each week across a broad range of subjects for every year group from reception through to year 10. I recognise all the challenges that families will be facing at the moment, and we're determined to support parents who are helping their children learn from home. I think we all know how difficult that can be. But BBC has developed resources for families as part of the most comprehensive education package in the BBC's history, available on TV and online from tomorrow morning. And to make sure as many children as possible can access online learning, we're ordering laptops to help disadvantaged young people who sit key exams next year. We'll also provide laptops and tablets for those children with social workers and care leavers to help them stay in touch with the services they need, keeping them safe as well as supporting home learning. And if disadvantaged secondary school pupils and care leavers who are preparing for exams do not already have internet connections, we'll provide free 4G routers to get them connected while schools are closed. We're also working with major telecommunications providers to exempt certain educational resources from data charges, so that this does not add to household expenses that may already be very stretched at this moment. Before I finish, I'd like to applaud the remarkable way our education community has responded to this outbreak. I'm enormously proud and inspired by the incredible spirit they are showing. Schools are supporting their communities in every way, from preparing food parcels to sharing their facilities with local hospitals. Colleges are manufacturing and donating equipment. And universities are working flat out to develop diagnostic tests. And of course, a vaccine, which will help us beat this invisible enemy. I'm enormously proud and to any young people watching, spirit they are showing. I wanted to say to you how sorry I am that you've been disrupted, you've had your education disrupted in this way. I know how hard it must be, and I'd like to thank you for making the adjustments that you've had to make. I know that you'll be missing your friends, your teachers, your lessons, and I want you to know that you are such an important part of this fight too, and I cannot thank you enough for all that you are doing. This global pandemic is the biggest threat to our country. It's the biggest threat that this country has faced in modern times. If we all continue to work together as we have been, and if we continue to stick to the advice of our experts, we will come out the other side and be able to begin the task of rebuilding our communities. I'd like now to hand over to Jenny, and then we will take some questions.
Thank you, Secretary. So I'm just going to talk briefly through 4 slides, which many of you I know will be very familiar with, but just to highlight the hard work actually that you as the public have achieved and the projection ahead as we see it. So the first slide is indicative of the social distancing measures we've all been working hard to achieve, and I think we need to congratulate ourselves but also maintain these measures as we go forward to ensure that we keep control of the pandemic as it is. This slide shows that since February there has been a more than 60% drop in our use of transport over all transport types, and particularly in rail and tube, recognising that it's just our essential workers who are going to work at the moment, and usage on that is down by 95%. We've had a little blip, if you like, over the Easter period where people have been at home anyway, and those normal levels, normal levels, if you like, for pandemic status are now resumed. So I think a lot of really good work, but work that we need to continue. Next slide. And particularly in rail and tube. Again, we usually look at the number of UK cases which have been confirmed. These are reported when lab tests are completed. It may come a little time after the initial laboratory test, and what you can see here is a rise in the cases that we reported through March, and although there is some variation on a day-to-day basis, in general there is a trend for the number of cases to be plateauing out now, and that is despite increased testing capacity. And that, I think, is reflective of the social distancing measures that we've had, but are also reflected in our hospital data as well. Next slide, please. And what you can see here is a rise. And this slide shows you the number of people in hospital over the time period since around the middle of March. There's a few dips in this, which we recognise from data collection, for example, around the early phase in April, but you need to look at the general trend across the picture. And for London particularly, it demonstrates not only the very significant amount of work that our hospitals have been doing, particularly around the start, first and second week of April, but also the success which is occurring now in the number of cases coming down over time. Now, again, there will be variation as we go forward. We shouldn't be looking at specific day-to-day variation, but it is the trend in that period. Equally, you can see that other parts of the country have had slightly different pressures on their systems, and it is really important that those areas continue to practice social distancing so that their hospital systems as well remain fully able, as they are now, with significant
the pandemic, and why was more not done to get hold of more PPE in March and early February, including using British companies?
Well, what we've seen what we've seen over the last few months is an enormous effort. It's a national effort, but it's also an international effort to secure PPE from right around the globe. But we've seen so many brilliant British businesses repurpose themselves in order to be able to provide it, and we've seen many educational settings also being able to do it. But, you know, the government, from the first moment that we were in a situation where the scientific advice was highlighting to us that we were facing a real challenge in terms of the coronavirus, and this could potentially evolve into a pandemic. Every resource of government has been deployed to not just expanding what we need in terms of PPE, but also ventilators, and we've seen a massive growth in the number of ventilators that we have available in our hospitals, and keep adding and building to the stock of what we've got. I'm not sure, Jenny, if there's anything extra on PPE that you wanted to add.
Happy to. So I think we perhaps ought to just step back a little bit and start from the beginning of this, which is the UK, regardless of the position that we may be in now or commentary, has been an international exemplar in preparedness. So the fact that there is a pandemic influenza stockpile is considered a very high quality mark of a prepared country in international terms. What we have had, as Secretary of State has said and many others have noted, is a huge demand on our supply. And I think we have had, if I might say from my own professional perspective, we could perhaps have a more adult and more detailed conversation about PPE supplies. For example, quite rightly, the conversation at the moment is very much focused on gown supplies. Earlier weeks, I'm very aware of consideration of eyewear, for example, in goggles and masks. And I think it is important to remember that although there may be elements of distribution problems across the UK at different times and in different places, this is a huge pull on services which we have never seen before. And we have managed, actually, despite signalling many potential shortfalls, to continue to supply going forward. And even as I stand here, I know with the gown position, for example, that even though when orders go in overseas, supplies may be very different, what is received to what we think we're going to get. We have worked right across the UK to try and manage those supplies based predominantly and always on a risk mitigation method. So this is about whichever patient or whichever healthcare worker at highest risk across the UK requires those PPE. And I think we perhaps need to, rather than lumping all of the PPE together, which is not a homogenous mix at all, we just need to think carefully through what has been achieved and the challenges which are acknowledged ahead.
Hugh, I'm not sure if there's a further question.
Can I ask a quick follow-up?
Oh, of course, yes, please.
Yeah. I mean, some companies are still saying, even this weekend, they want to make and supply the PPE. They're offering it, but people at the centre are either not replying or just not coming back to them.
I mean, we've seen over the last few weeks a massive increase in the amount of resources that have been put in terms of providing PPE, and a billion extra items of PPE have been brought into this country, and we recognise to support our NHS, support those care homes, we need to be looking at every way that we can bring in more. I would sort of, I know that the Health Secretary and I know the Cabinet Office are doing immense work trying to find British suppliers, so I would encourage them to, through yourself, to be able to make sure we pick those out and we make sure that we get in contact with them over the next 24 hours if they sort of in any way slip through the net. We recognise this is a national endeavour, and we're so incredibly grateful for so many people who are willing to step forward and make a real difference, and we certainly don't want to miss out on those opportunities. So please do send that information to us, and we'll make sure that we chase those up within the next 24 hours. Thank you ever so much, Hugh. If we go to Dan Hewitt at ITV. Dan, please.
Good afternoon, both of you. First of all, a question to both of you, really. The NHS Confederation, which represents hospitals, has today told ITV News it would support any doctor or nurse who refused to go to work because they feared they weren't able to access the correct PPE. Are they right to back them? Would you both personally be comfortable today working on a COVID ward, having to reuse what's meant to be single-use PPE? And secondly, to the Secretary of State, on the 30th of January, the World Health Organization declared a global health emergency, yet Boris Johnson didn't attend a single COBRA meeting until over a month later on March the 2nd. What was he doing in the meantime that was more important? And is it acceptable that he was being briefed rather than attending any of those meetings?
So, Dan, thank you ever so much for that. If I maybe pick up the latter half of that question, and Jenny will maybe be able to speak a little bit more on the PPE side of things as well. The Prime Minister, from the moment that it became clear that there were challenges in terms of coronavirus developing in China, has absolutely been leading our nation's effort to combat the coronavirus, making sure that resources and money is not an issue or a concern for any department, especially the health service, in terms of dealing with this. And as you will well know, and I know as journalists you're very aware of this, many COBRA meetings take place, many hours attending COBRA meetings where it's actually led by the departmental minister. But the focus that the Prime Minister was putting on this and can just continue to put on this has meant that this is the whole government effort. We're making sure that we do everything that is required and everything that is needed to make sure that we protect the NHS and make sure that we save lives. And that is the government's policy, and that is what the Prime Minister has been driving right from the start and when there are those initial concerns about this development of this virus. Jenny, I'm not sure if you'd like to pick up on the PPE.
Happy to. So I think I'm not going to comment on behalf of the NHS Confederation. I'm going to comment as a healthcare professional. If I happen to be working on the front line today, I have a responsibility to look after patients to the best of my ability, to protect my colleagues and my staff, and to manage my practice safely. So all of those in the current climate will mean that I need to understand the agreed guidance on PPE, which has been agreed with all of the Royal Medical Colleges, and to implement that whenever I can. I think this use, and it goes back to my comment earlier to Hugh Pym, it's very easy to make a throwaway comment about single-use PPE. Some PPE is single-use. Some PPE that has previously been used in different diseases, in different settings, may be single-use. But we have very detailed guidance now about what PPE should be used in which settings. It is actually quite complex, which is why as a professional, I think there is a responsibility on me to understand that. And it is the fact that we are in a global shortage, whether we are in the UK or whether we are internationally, actually, we all need to use this PPE carefully. So I think it's really important when you say, obviously we can't do a description here, but if there was a particular intervention, some sessional use is entirely appropriate. So, for example, wearing a gown for sessional use with a disposable plastic apron on top of it is an entirely appropriate use of PPE. And in that example, you can see there is one element of what some people may call reuse and one element of what some may call